This is an arthroscopy on the right knee of Mr. Simon Collett, performed on the 19th of June 2014. Now we're starting the examination on the inside of the knee. A fairly abnormal knee here, not surprisingly, quite tight to get into. Again, not surprising in view of the previous injury. You can see, first of all, there is a fair amount of blood in the knee. Shows there is quite a lot of general inflammation. But the basic anatomy here is fairly normal. Up at the top here we've got the femoral condyle. Now you can see there are just one or two areas there where the articular cartilage is beginning to flap up. It's slightly irregular, but we can't actually see bare bone. If we look around here, here's the medial meniscus. That seems to be intact. Around here we've got quite a lot of scar tissue, synovitis. You can see this sort of beginning to flap into the joint. So what I'm first going to do is just tidy up this soft tissue and then just smooth over the articular cartilage. So having cleared away some of this tissue at the front here, we can see there is loss of articular cartilage over the front of the condyle, and as we saw before, just that little bit of flap there. So we're just going to smooth that over here. Now this is the outer half of the knee. This has fared rather better. You can see a really fairly normal articular cartilage over the femoral condyle. The tibial plateau looks fine. And at the back there, we can see the lateral meniscus that's intact. If we come now into the centre of the knee, we see that your anterior cruciate ligament has also survived. That's looking fine. Here you can see a little bit of that synovitis with some bleeding around there, but the bulk of the tendon, of the ligament looks absolutely fine. And now we've got to look at the patellofemoral joint. To get you orientated, up at the top there is the kneecap. You can just see at the bottom the femoral, the front of the femur, the femoral trochlea. And then to the side here, on the right hand side, there's a mass of fibrous tissue, which is probably scarring related to the insertion of your tibial nail. And this could be well getting caught in the joint there. So I'm just going to clear that space out so we can have a good view of the patellofemoral joint. So you can now see where I've cleared away that scarred fat pad. Up at the top here, the undersurface of the patella, and here's the femoral groove. Now, as you can see, just like in the medial compartment, there is moderate wear there, and rather more wear over the patella itself. You can see up there, that's actually down to bare bone. That's the only part that is actually down to bare bone, though. Well, actually, no, there's a little bit there. So, the patellofemoral joint down to bare bone, but the medial compartment, reasonable articular cartilage, same with the lateral compartment. And over on the lateral side here of the patellofemoral joint, there is a good articular cover. So we'll just finally wash the knee out thoroughly, just remove the last few tags of soft tissue, and then pop a couple of stitches in.